Hi, my name is Jocelyn Elliott, and today I'm going to be discussing naturalistic interventions for speech intelligibility for children with speech sound disorders. Naturalistic intervention is an approach to therapy that is child-led. It promotes the child's speech intelligibility through modeling, targeting sounds that are in the child's everyday environment, things that they're interested in and in their daily context. So speech language pathologists can use this method. They can easily teach family members and parents, as well as teachers, on how to implement this naturalistic intervention method. These are various steps for the method. Identifying target sounds that you want to work on. Definitely want to make sure you're collecting a baseline in the beginning of therapy. That way you have something to compare progress to and you can stay organized. Identify the child's daily routines to get an understanding for what the child is interested in and how to use their daily contexts in therapy. Provide training to other team members, such as teachers and family members. You want to make sure you're setting up the environment to elicit the target behaviors that you have set for the child's goals. And you want to elicit target behaviors. And step 6, we will discuss in a moment. Key components to this approach are to make sure you're having the child lead. You want to establish joint attention with the child through playing and games and things that they are interested in. You want to make sure that you set up the environment to make sure it's interactive, not overwhelming, but making sure that it's interesting for the child. You want to use everyday skills to build the child's framework for learning, and recasting is a key component. We'll also talk about other components for eliciting speech sounds. And here they are. So the first one is modeling. You want to model the correct production. So that would be saying, this is a phone, or this is a block. And then you to use man modeling by, you have just modeled, no expectations, and then asking the child, what is this called? And then they say block. You want to also use the strategy of modified time delay, which would be waiting a moment for the child to respond. And then incidental teaching can be very useful to creating just a natural conversation, natural instances. Maybe there's a toy on the top shelf and the child points, I want that toy, and uses their words to ask for what they want. These are some contributing factors for improving speech intelligibility. So a child is speech is intelligible when they know how to produce a certain sound and how to appropriately use the sound. A study showed that phonological therapy improves speech intelligibility. Studies show that that's effective. Speaking rhythm and rate, so the child's prosody, appropriate volume of speech, being able to engage with others in social context, and staying on topic is really important for speech intelligibility. The child's social skills are very important, and being able to appropriately form sentences that are coherent, and that would be the child's syntax skills. Some evidence that supports naturalistic intervention. This meta-analysis conducted in 2019 showed that naturalistic intervention had a small effect on improving expressive language, reducing symptoms of autism, and improving skills for playing. And better outcomes were shown for improving social engagement and the child's cognitive development. So children are learning social skills through this technique, which is very useful. And more evidence showed in this study that looked at effects of modeling names and sounds combined with instructive feedback the effects it has on phonological awareness for children in preschool. Their findings showed modeling and time delay improved the child's phonological awareness for the children in this study. Instructive feedback as a modeling technique can enhance the child's sound awareness, which can improve intelligibility. Time delay effectively elicited responses for most children. All children are different, so some children aren't going to respond well to that, but most did in this study. Research, the study showed that it requires minimal training to teach others, like parents and teachers, how to use the skill of modeling to elicit target behaviors. It's easy and effective to learn and teach. Enhanced milieu teaching effects on speech intelligibility was studied by Kaiser and others in 2017. This randomized controlled trial showed better intelligibility outcomes for children with cleft palate who received naturalistic intervention, with an emphasis on phonological skills compared to children with no treatment. So the intervention methods they used were modeling and recasting the child's production, recasting, also like expanding on that. So they say block, and you say that is a block. This block is red. So you're recasting and expanding. And they also used and set clear articulation goals in this particular study, which is very important. The findings showed enhanced milieu teaching is more effective than no treatment, and it was proven to be a reliable treatment option for improving speech intelligibility in children with cleft palate. An emphasis on those phonological skills is important and was very useful. So who is best suited for this intervention? Children who can imitate, it can be very helpful. So they can imitate what you were saying, and they are able to also recast. Children between 0 and 11 years old. So you're modeling to, let's say there's an infant, you can even model how to say something to them. So when they're playing with a toy, you can say, yeah, bunny rabbit, that's a bunny rabbit. Bunny rabbits are white. And so that's just exposing the children to language, teaching them how to be socially engaged, and it can be very useful. Children with articulation disorders, cleft palate, autism spectrum disorder are best also suitable for this intervention. Some considerations are to stay organized, setting clear goals, and using clear methods and understanding how to use those. A systematic approach to this is very useful in helping to stay organized and collecting the proper information that you need. And also parent facilitation, so using or having parents implement this to help generalize therapy outside of the classroom. And this is an example in action of naturalistic intervention. I thought was very useful in this video. We won't watch the link.
Right, we're gonna play with the farmhouse. NET helps clients generalize their learned skills in new environments and situations. Here, you can have one. What's this? Pig. A pig, it's a cow. What's this? Cow. Cow, good job. And a cow says, oink, oink. Oh, good try. Cow says, moo. Cow says, ooh, that's a good cow impression. I love it.
Good clinician.
Where's our horse gonna go?
Man modeling.
What does a horse say?
Recasting.
Quack, quack. Good try. Horse says, neigh. What does a horse say? Neigh. Good job. Here, put our horse in the barn. On top of the barn. Let's put it right here. Good job. And then what's this? Oink, oink.
And so you get the picture with that video. It's very useful if you'd like to continue watching. It can be good to take notes, and it summarizes the skills needed for naturalistic intervention. So I hope that this video is informative and that you all learned something. And thank you for watching. These are my references. And that is all I have today. Thank you.